There are strong parallels that humans show in the reaction to trauma with other mammalian species. And because of this, there has been great interest in using neuroscience to advance treatments for PTSD. An important new article appears that examines how neuroscience teaches us about memory. Brunet and colleagues use a memory paradigm paired with propranolol to see if a form of memory-related therapy can enhance treatment for post-traumatic stress disorder. This study comes directly out of the neuroscience literature, and it compares a memory reactivation paradigm with propranolol to a memory reactivation paradigm with placebo. And important results emerge. They suggest that by using propranolol, it might one day be possible to blunt the emotional content of memory. And this is an important finding because there have been many attempts to use propranolol to blunt memory in ways that are clinically meaningful, but Brunet and colleagues provide particularly powerful results relative to previous attempts to use this therapy. And this should generate interest among both clinicians and neuroscientists alike about how these two areas of research can come together to shape how we care for patients. We know from clinical studies that the seeds of psychopathology begin very early in life, potentially in the prenatal period. Recent research is attempting to use neuroscience to extend these clinical insights. And Sandman and colleagues provide important new evidence on the underlying neuroscience that might account for the relationship between perinatal stress and later psychopathology in children. This study assesses levels of the peptide CRH in the serum of mothers who are pregnant. And this is a key regulator of the stress cascade in mothers. The study then follows the babies and assesses their brain structure as well as the baby's own symptoms of psychopathology as the babies pass through the first few years of life. And the important findings to emerge from Sandman and colleagues is to suggest that levels of CRH in maternal serum, indicative of high levels of stress, predict alterations in the structure of the brain of the infants who are exposed to the levels of CRH during pregnancy.